All right, Laken, welcome to the podcast. Thanks for coming on.
Thanks for having me.
You're welcome. I'm super excited to chat today. Before we started recording, I was talking about how I've been following Laken for a while. I'm not sure how I found your account, but I'm super interested in what you do, from the virtual coaching that you've been doing, the PT content that you put out, and also your interest in sort of the more holistic wellness side of things, red light therapy. So we're going to get into all of that today. But first, just kind of tell people about, I guess, where you went to school, how long you've been out, and then what you're currently doing for work now.
Yeah, so I went to school at the University of St. Augustine. I loved it there, met all of my really good friends there. I graduated about like 6-ish months ago, and right out of school, I took a job with Unleashed Athletics with the CEO, which is Doc Sam Moves on Instagram, where I use my knowledge in my training, as a doctor of physical therapy, and I coach active people in pain 100% virtually through customized training, nutrition, mindset, and habit coaching. And it's honestly been like a 180, like traditional care to what I do now, completely different environment. I love showing up. I don't even like want to call it work because honestly, like I go in and I love all the people that I get to work with. I love helping people train, get back to races. I love someone who's motivated and willing to learn, and we just have such a great team. We work with Dr. Sam has, Paige on our team. We have another physical therapist, Coach Kiana, and it's just been so amazing. And literally, like, thank God that I found this job because I don't know how long it would have lasted in traditional care, like, to be quite honest.
That is so interesting. So I mean, when you were at University of St. Augustine, did you ever envision yourself working in the virtual space, or was this something that you sort of found by happenstance and then decided to apply? Like, how did you end up there?
I sort of just found it, and it was honestly throughout my clinical time, towards the end of your training, you go through these clinicals. And I was managing it, but I wasn't really enjoying it. And I was like, there has to be something else out there where I can use my skills that doesn't make me feel so bad or so burnt out. I was seeing 50 plus patients a week, sometimes more, depending on the clinic that I was in. And I just couldn't give the care that I wanted to provide. I couldn't talk about the things that I wanted to talk about. They're like, no, like we don't have time for like to talk about sleep or like to talk about nutrition. Like that's not within your scope. And I was like, well, it's not within my scope to help with maybe disease specific, but it is within my scope to talk about nutritious meals. So I should be able to talk about that. And with this job, I have the flexibility to do so, and we really see results. So it's been really, really fun, and I'm really grateful.
That's so interesting. And I think the virtual space is just sort of getting started in terms of the
Mhm.
PT realm, right? And like you mentioned earlier, the people that are motivated and you being able to work with those types of patients, I think they're more common to find in the virtual space because they're seeking out your services, right? Like they're not being sent by a doctor necessarily or being forced to be seen for a certain amount of visits before they get their MRI. They're paying probably a premium for your services and expecting to see results and then working alongside with you. So that's got to be a nice change of pace, probably from some of the outpatient settings or even inpatient settings you've seen.
Yeah, it's definitely, I'm definitely grateful. And you're right, like they are seeking us out because they are motivated and want to change and are just tired of, maybe not having the body that they, where they can do all the things that they love to do anymore.
Right. And you mentioned, so do you go into work and work virtually, or are you working from your house?
I
Do you
work from
see,
home.
okay, you work from home.
Mhm.
And then do you ever get to see the other employees that are within Unleashed?
So, like, we have a meeting every week and we always connect. We have a group chat where we can always ask questions. We're actually going to go on a team retreat soon. So, I'm really excited for that. I'll actually,
Fun.
because we're all over the world, right? But we come together every week and we always, ask questions to each other, chat, talk about anything, make sure we're all aligned, like in the vision and the mission. But yeah, we'll be able to actually meet each other in person soon. So,
That's cool. Where are you guys going?
We're gonna go to Texas.
That's nice. Okay,
Mhm.
good. I'm curious with because I've done some virtual visits as well, and
Mhm.
honestly, they've been more successful than maybe I had originally thought that they would be because you don't really learn about virtual PT in school. It's just something that you sort of have to learn on the fly as you go. Do you think that there's any limitations in your scope of practice with not being able to be with the patient hands-on?
So yes and no. I think Dr. Sam has created like such a curated and customized and thorough approach, like when we onboard a client. So we have like a whole educational series for them. They're getting a lot of knowledge. We go through functional assessments. We have a lot of different assessments that we use. They will record it and send it back to us. So just like how you would do active range of motion and, other functional assessments, we can see that, replay it in real time on our end, kind of go through what we want to work on. And then anything else, like if we want to check on like strength balance assessments, then we have a whole docket for that as well. The only thing, and that's one of the reasons, why I wanted to look more into red light therapy was if someone is in, a lot more pain, because then that's when hands-on care is really beneficial to get that hands-on treatment, whether that be like soft tissue mobilization, dry needling, what have you. So I would say there, I have some tools in my toolbox to help educate and, do self mobilizations or, foam rolling, what have you, like self massage. But I don't think it can, if someone has a higher pain level, then that's when we might bring in and say you should go to in-person PT to just kind of get things under like manageable pain levels.
Okay, that you sort of just answered my next question because I was gonna ask if you ever sort of collaborate and co-treat with in-person PT while also doing the virtual
Hmm.
sessions.
Yeah, so I try to collaborate as much as possible, whether that be like in person PT or if they go see like a registered dietitian or if they have their own coach, making sure like we're all on the same page. Or if, someone's dealing with something else like a thyroid problem, and we have to be like a little bit more creative in our approach to make sure we're covering all of our bases.
Got it. Okay. So you mentioned red light therapy, and I do wanna get into that next because that's part of the reason I wanted to have you on. I think it's super interesting, and we briefly brushed on it in physical therapy school, but nothing in depth. And so from the content I've seen you post, I'm just curious what benefits you've found and how did you get into it in the first place?
Mm-hmm.
And then kinda talk a little bit about how you implement that into your patient's plan of care.
Yeah. So, red light therapy is a non-invasive treatment using low-level red and or infrared light, and it's used to help heal skin, muscle tissue, and other parts of the body. I honestly got into it because I'm a skeptic. So, we learn a lot about a lot other biophysical agents in PT school, and not all of them are research based. And
Correct.
so I was like, well, anytime I see, a gadget or a device that has a lot of claims on it that, sometimes maybe like looking outlandish, I'm like, okay, like let me look into it myself because I wouldn't want a patient or myself or a family member to go and spend as, expensive as they are, a lot of money and it not be beneficial in any way, shape, or form. So that's really like how I got into it. And also thinking when someone is in pain, unfortunately, they're taking or they're eating like NSAIDs, unfortunately, like candy to go to bed or to just get through the day. And so I was like, if there is a tool that we can use that's more conservative that may mitigate their need to use it as often, I think that we should look into it and consider it, just like with any other pain modality that we would be using, right? That's
Right.
conservative. So I didn't research, everything. I tried to keep it limited to what would be like most beneficial for like my clients, or it's something that I found interesting. So just like a highlight overview, starting like at the top, right? There's a mountain of evidence to support actually its use for like anti-aging benefits, which we see that a lot kind of like on social media right now by like supporting our skin elasticity and collagen production. It can also help with acne by killing acne causing bacteria like on the skin. It plays a major role in recovery time for wound healing. So, especially if someone may have like a compromised vascular system, such as like diabetes or what have you, but can also support like a positive healing environment for post surgical wounds. So, that could also be like small cuts and scrapes and burn wounds. Fun fact, it's also a FDA approved like hair loss treatment, which I didn't even know that.
I didn't know that either.
So I think that that's really cool, like a conservative option for someone to go and get treatment for if they wanted to. It supports recovery by decreasing muscle soreness, tension, and stiffness. It can also help with nerve pain, which I know a lot of people deal with, especially like with back pain or sciatica type pain, radicular pain. There's early evidence to support its benefits with cognitive health too. So that's something I'm sure we'll kind of learn more about as it unfolds in the research, like for years to come. And then one thing I do want to touch on is there are some claims to support eye health, but honestly, it's like very early in the evidence from what I've seen. And there are potential risks if someone has direct eye exposure to red light and infrared light. So I would probably just like recommend to be more cautious on that side of things. And the device usually always gives you eye protection, so I'd recommend just utilizing that.
Got it. And with your patients, when you're recommending that they implement this into their plan of care, say they're more like a chronic pain patient who you think they'd be appropriate for red light therapy, what type of devices are you recommending? Because I know there's like the infrared saunas, which are
Mhm.
different than the devices that you apply directly, which are different than the face masks you see all over social media. So, what's your preferred product?
Yeah, so some things that I look for that I would want to make sure are checked off first is like we just talk about the wavelength. Most of these devices have the appropriate wavelength, right? There's two wavelengths that are most highly researched. So they are 660 nanometers and 850 nanometers. So
Okay.
if a device has that, great, like you're already halfway there. If some devices can have more wavelengths or multiple wavelengths, so as long as it's within the spectrum of red light and near infrared light, which I can give those specifics too. So for red light, you want it to be between 620 and 780 nanometers. For near infrared light, which would penetrate deeper tissue, would probably be used more so for tissue healing, for pain reduction. That would be 790 to 1400 nanometers. It's not just about the wavelength though. It has to be considered with irradiance too, or its power density. So a device can have a lower irradiance, and we would need a longer treatment time, or it might have too low of a irradiance to not even show therapeutic benefits. So, for instance, for that, like for pain and healing, we would want to have a device that has a reading of 100 milliwatts per centimeter squared or more. That would
Okay.
probably be what's recommended. If someone is like maybe a little wound healing, maybe a little skin, like aging backwards type thing, anything that's more surface level, the irradiance can be somewhere between like 20 milliwatts per centimeter squared, but then less than 100. That would probably be most appropriate. Some other things that I would look for, making sure like you're either seeing this on their website and checking that off in your boxes, is looking to see if it's FDA registered or FDA approved. That's really important. We also want to make sure that it is professionally third party lab tested for safety, for its irradiance, and then also for EMF exposure as well.
Okay. That was very thorough. I'm impressed. So, at this point, with the virtual training that you're doing,
Hmm.
how often are you recommending that patients go out and purchase this type of device or seek help in terms of just the red light therapy usage? Is it something that you're always talking about or
Yeah, it's a really good question. So it really depends on the client, like where they are in their healing journey, obviously their pain levels, and if there are any low-hanging fruit that need to be addressed first. So I always say don't miss the forest for the trees here. If you are chronically stressed, if you are not having nutritious meals, if you're getting zero sleep, if you have so much mental load throughout the week, those are the recovery strategies or recovery tools that need to be addressed first because that's going to be the biggest bang for our buck, right? Red light therapy is just kind of a tool to supplement. It's definitely not a requirement, but it can support an optimal environment for our healing.
and I've seen on social media some of the posts you've done, you using it
Mhm.
for yourself. So what does that look like?
So for myself, honestly, I really use it for two things right now. So I probably use it like 1 to 2 times a week. I have a device that has a timer for like 12 minutes. So I'll just have it on for the 12 minutes and use it 1 to 2 times a week. I'll use it on the back of my neck, especially if I'm feeling like some tension creeping up. I'm prone to having some neck pain, probably like all of us who are sitting at our computers for most of the day. And then I'll also use it like on my face for the skin benefits as well. If I've ever had like some TMJ pain to like kind of creeping up, maybe if I'm higher stress level that day or what have you, then I'll use that and I swear like it drastically reduces my perception or symptoms of pain. Maybe not down to zero, but it's definitely going down like almost immediately.
That's so interesting. And then few times a week, you said? A couple times
Yeah,
a
like
day? What's the ideal frequency for that?
so for me, like this is just what I felt like my body needs, what I feel like it gives me the benefits. So I use 12 minutes right now, like 2 times a week. There's no like hard and fast rules that I've seen in the research. I think it's really dependent on like what the goal is for the treatment, um, the device that you're using, the irradiance of the device and like the target tissue. So for instance, like if you're using just you want it for skin versus maybe like your knee pain, those are going to look a little bit different. So I would be remiss to say that I've seen any specific protocols. A general like rule of thumb is I recommend starting out slow, kind of see like how your body responds, maybe like every other day or 3 times a week, and then increase every like 1 to 2 minutes every week until you feel like you get the desired output that you're feeling. So more isn't necessarily better. Red light therapy kind of works on like a biphasic curve. So there's like an optimal dosage right in the middle, and then it kind of drops off. Like the more you do it, you don't necessarily get more benefits, just like with exercise, right? Like too little, then we don't really see any benefits. There's this optimal dosage for exercise, just like with red light, and then more exercise, you kind of don't get those same benefits anymore. So it's like a teeter totter of finding what works best for you.
Got it. What are your thoughts on the infrared saunas? Because those have definitely become more popular in recent years. I've never personally tried one, but I'm interested in them.
I've never personally tried one either. I haven't looked much into it, to be honest, so I don't know if I have any opinions. I think if you're doing that, then you're probably already pretty health conscious and doing all of the
Right.
other, things that I would think would benefit you just as much or more so. So I don't really have any, strong opinions about it. I think it's probably helpful.
Have you ever been a sauna girl or like a cold plunge girl before?
I have been a cold plunge girl, but saunas, like something with my migraines, I get migraines a lot, which is one of the other reasons why I was looking into red light therapy because I had to get off my migraine medication. And so I can't really do the saunas. It makes my head like kind of pulse, you know what I mean?
Yes,
It's
I do
it's
know
like
what you mean.
it's like a trigger to me kind of. So I have to be careful. And I already live in Florida, so 90-degree, 100-degree weather. I'll
Yeah,
take the cold plunge, but I
the
really don't.
sauna's already outside, like, if you just walk out your front door,
Yeah,
there's the
like
sauna.
I'm already sweating.
That's a good point. We have a cold plunge my husband built, like, in my garage, and I was really into it for a while, but then I saw some research about how women are really not supposed to be exposed to that cold of water. Like,
Mhm,
men can do 35 degrees, but it's
mhm,
better for women to be, like, 40s or 50s,
mhm.
and so I told him, I was like, "I can't do this anymore, it's too much for me, it's not good for my hormone
Yeah.
health."
Like, it's not because I don't want to, because I can't handle it, because I definitely can, but, like, it just needs to be, like, a little bit higher for
Yeah,
me.
it's just, like, the research supports, and I'm just really a research girl, so
No,
yeah,
100%. Yeah, I have
yeah,
seen that as well. I haven't, like, looked too much into it, but I think there are definitely some benefits for the cold plunge.
absolutely, especially in terms of the if you're having severe DOMS, like delayed onset muscle soreness or just inflammation. My husband right now is having like this cervical radiculopathy issue, and I'm like, the cold plunge would help. I think it would help.
Mm,
So there are some benefits to it for sure. Same with sauna, but
yeah,
um,
has he been doing it?
no.
That's okay.
I think it was a phase he went through, but
Yeah.
we'll see. We'll get him back on board.
Yeah, that's good.
So with red light therapy, are there any well, you mentioned a little bit the potential for harm with eyesight or just having direct exposure to the eyes. But are there any other risks associated with it?
It's honestly, like, relatively low risk and low side effects, but I would say is there are some cases where I would say maybe don't use if consideration. So that would be someone who has, like, more eye sensitivity than others. If you're trying to put it on an active area of infection, if you have, like, active or previous history of cancer within the past 5 years, nobody's going to do research on pregnant women, right? So we always say no pregnant women, obviously, to keep you guys safe and babies
Of
safe.
course.
Taking any medications that would affect like your skin sensitivity, especially. So think like maybe Accutane, things like that. You probably want to be careful if you're going to use it around your face. And then some other things just to know is like if you did have any, worsening symptoms such as pain, discomfort, or you were getting some skin irritation, it's probably best to discontinue it. And of course, like if you feel like you need to get a second opinion, then always consult like with your medical provider first.
Very cool. I feel motivated to try some. I have seen lots and lots of Facebook, Instagram ads for the mask that goes over the face
Hmm.
that does the red light therapy.
Hmm.
Do you use one of those?
I don't have a mask. I just use my device, and even with that one, I get the benefits. So remember, like with the mask, you just have to make sure, like, okay, is it a radiance that I want? Is it the wavelengths that I want? I think you can still have the benefits whether you're using the mask or the device. The mask probably just gets closer to the skin and covers your full skin.
Right, right. Yes, that's gonna be something that I look into because whether it's the device or the face mask, I just would love the skin benefits. I think that would be amazing. Of course, once I'm not pregnant anymore.
Yeah, it's pretty immediate. Like you can, especially like if you have acne, if you feel like you have like a little fine line we want to get rid of, like yet the complexion totally changes. So it's really cool, especially for someone who wants to get these benefits but doesn't want to, go and get injections or things like that. Like this is a nice holistic, low side effect approach.
I feel like you're a good spokesperson for this because you also have really good skin. So if anybody doesn't believe, like, just go look at her Instagram page. You'd be like,
Thank
"Oh."
you. Thank you.
Yeah. So do you think that this type of red light therapy will become more commonplace in just your basic outpatient clinic in physical therapy?
I've seen it, but it's like I think it will get more popular, but I also think it depends on if it's traditional, if it's cash based. I think it can have a lot of benefits, just like with any of the other modalities that we're using. And so I think it's also just important to have the education behind it first. So this was part of my doctorate research as well. And I brought it to the clinic, and they're like, oh, I never even, like, I just thought it was like bogus. I didn't think
Mhm.
that this was actually like a real thing. But when we look at the research, we're like, no, it could actually really benefit clients and benefit our patients. So, like, oh, okay, like I'm more inclined to maybe look at a device.
Yes, that makes sense, and I think first, before devices are more commonplace in the clinics, just PTs being more aware of it and being able to recommend it because, the power of education,
Hmm.
that's half of what I do is
Hmm.
telling people what I think could be beneficial. So,
For sure.
even if I didn't have a device, just now having this knowledge to then be able to provide my patients
Hmm.
and then send them on their way armed with the knowledge of how this could potentially help. I think that's an even better benefit, I think.
Absolutely.
Yeah, for sure. Alrighty. Well, I feel like we've pretty much covered all the questions I had for you. I really appreciate you coming on. This has been a fun one.
Yeah, thank you so much for having me. I'm glad we got to chat for a little bit.
I guess in closing, if people are curious about red light therapy or just like the virtual PT space, how can they find you, contact you, and talk a little bit more about that?
Yeah, I'm most active on Instagram right now. And my Instagram handle is Dr. Laken Babics. I do have a free red light guide, so you can just message me red and I can send it to you if you're curious about learning more. But I do post educational content on red light therapy as well as other holistic treatments and physical therapy as well.
Yes, she's got a great Instagram account. Give her a follow. I did a while ago, and that's how we ended up here. So,
Yay, yeah.
all right. Well, thank you so much again. And I'm sure we'll be talking soon.
Awesome. Thank you for having me.